So prioritizing questions, delegation questions, assigning questions, leadership questions, those are considered management of care. So I'm going to put MOC. MOC. So that's a management of care category. And that's a category of questions that not only will you get on the NCLEX, but you also are seeing those in tests that you're taking in school. So by popular requests, a lot of my Instagram followers have requested, please do a video on assigning and delegation and how to do that and what to know. So I'm going to show you something that I share with my tootRN students that work with me for NCLEX preparation or just for test taking skills in school. Something really important to remember. So we're going to focus big time on assigning. So let's put that there. So assign and delegate. And we're going to talk about some things that you should remember when you are taking a test, whether you're practicing, whether it's a live test, real deal in school, or whether it's the NCLEX, whatever the case is, to help you to better understand how to do these things. So one of the style questions that we get fairly often is an assigning question. So who do we give to the LPN or the LVN, depending on where it is that you live? So how do we know how to assign a patient? These are going to be the questions that say, the nurse has all these patients. Which one should you give to the LPN? Which one is best for the LPN? Which one should the LPN provide care for? So when you have a question like that that's asking you what patient to give to the LPN, there are 3 things you must consider right off the bat. And these 3 things really do go together and they're quite important. So let's talk about them. The first thing is acuity. The second thing is age. And the third thing is time. So when you're looking at a question, that says, what patient should the RN give to the LPN? I want you to look at each of the patients and consider these 3 things: acuity, age, and time. What does that mean? Acuity. We want to give the LPN or LVN the most stable patient. What makes a patient stable? Well, a patient is stable because we can both predict what their outcome is going to be, and it's going to be something that we expect. And it's not going to be something bad, not something that is too critical that we can't care for. So as an example, if you have a patient that has a cold virus, you can predict the outcome of that and you know what the expected outcomes are going to be. So my outcomes are going to be predictable and expected. I'm your patient with a cold. You know that I'm probably going to feel crummy for a couple of days. I might have a cough, sneezing, runny nose, maybe a low-grade fever. But within those few days, my symptoms should resolve on their own and I'm going to be fine, right? So you can predict those things. That's a stable patient. If you can't predict my expected outcomes to recovery, then I'm not a stable patient. That means that I could be okay or I could die, but I'm not really sure which way that's going to go. So we don't want to give that patient away. The other thing is age. When you have to choose from a list of patients and there's a child in the mix of adults, normally, the RN should not give away the child. That's just a general rule. So if you have a child in the mix of adult patients, the RN should keep the child. Now, when does that get a little bit different? Well, when you're working with the list of patients that are all pediatric patients. In that case, start to just kind of keep an eye out for the youngest one. So if you have a list of peds patients, and let's say one is 18, one is 12, one is 9, and one is 6 weeks. Well, that 6-weeker, keep your eye on that because that's a really young age and likely should be left for the RN. Now, the last thing to keep in mind is time. That means how long has it been since something has happened with that patient? And that something can be a lot of things. How long has it been since that patient had surgery? How long has it been since that patient had a medication? How long has it been since that patient fell down? How long has it been since that patient was admitted? If the patient recently experienced something, then that patient should not be given away, because the nurse is going to have to assess that patient, evaluate that patient for any changes, anything that's new, and provide any treatment that that patient might need at that time. And that goes kind of hand in hand with something else that you may have heard. And this may be from, I don't know, this circles around, so many different areas. Eat. Don't delegate anything you can eat. So that goes with here, right? Evaluate, assess, or treat. Not sure who coined that, so I want to give credit to whoever did it. I don't know who did it. Again, it circulates all over the place, but this is another good thing to help to remember. So, with our assigning questions, when we have to give a patient to the LPN, we need to remember these 3 points: acuity, age, and time. Think about them all together. If you have a patient that is high acuity because they're not stable, they're very young, and they've recently experienced something, that's not a good patient to give away. And you can look at them individually as well. For instance, if you have a patient that just had brain surgery yesterday, that's our time factor. Not a good patient to give away. Because they had surgery on their brain, we know their acuity is high. We can't predict that the person's going to be okay. So we're going to consider that as well. If we have a patient that, let's say, as an example, has bacterial pneumonia and they're 2 years old, well, that's an age factor, right? The 2 years, and bacterial pneumonia can be an acuity factor as well. So remember all these things when you're working with these questions, and ask yourself that. Another thing really important to consider is we want to consider overall the care that the patient's going to need. So always ask yourself, before you give away a patient to the LPN, what is this patient going to require? What type of care are they going to need? Is this something that is within the scope of the LPN? Can they do that? Okay, so let's erase these things. Now we're going to go right back to delegate. And so one of the things that I hear questions on all the time from students is when we talk about delegate, we're talking about what can the LPN do, what can the RN do, what can the UAP do. So when we think about delegation, we think, okay, well, the RN can pretty much do it all, right? RN's going to be the top. What can our LPNs do? We need to know the scope of practice for the LPNs. So the LPNs are not going to be caring for high acuity patients that we just spoke about. Really, they're going to be caring for stable patients who have expected and predictable outcomes. And we want to give the LPN things that are within their scope. For instance, we're not going to give a patient to an LPN that is going to, let's say, require an IV initiation, unless we know that LPN is IV certified, right? Because that's not something that is within their initial scope. We don't want to give them a patient that's going to require blood transfusion, traction care, those type of things. Now, when we get down to our UAP here, our UAPs can do things that are routine care, activities of daily living, tasks that are unchanging. So for instance, UAPs can do ECGs. That's an unchanging task. That process is the same. Placing the leads is the same. The machine is the same. Blood glucose, checks. They can do those things. They can help the patient bathe. They can help the patient walk. They can provide routine care to the patients. That's within the scope of the UAP. Something really, really, really important to know, and I'm going to make a big point of this. So I'm going to put this here. Nurse practice. Why? Because each state may operate a little bit differently and may determine that an RN, an LPN, and a UAP scope is different compared to another place. So make sure that you know your own state's Nurse Practice Act and what an RN can do, and an LPN can do, and a UAP can do, and be clear about what's within the scope of practice for each one of those professionals. That's going to be very, very important. So again, with the management of care questions, big thing, knowing the scope for everybody. Second big thing, using that strategy to help guide you when you have those questions about who do I give away to the LPM. Think about acuity, age, and time. Okay, lastly, let's talk about some trigger words. So things that we want to look out for when we are looking at questions. Now, these are the things that should jump out at you that we need to really pay attention. For instance, monitor doesn't mean the same thing as measure. So monitor is we are really observing, right? We're looking for changes. We're watching what's happening. Measure means we're just taking something, right? Just going to see how much is here, what the number is. That's it. I don't have to do any type of, assessment on it. There's no thought process really behind that. So RNs, LPNs, these people can monitor. UAPs won't monitor, they can measure. So that's an example of just looking out for trigger words and making sure that when you're choosing an option and it's asking you what activity can the UAP do, can the LPN do, can the RN do, look out for those words like assess, like teach, like evaluate, like measure and monitor. Those are some trigger words to pay attention to and really think about what they mean and is it within the scope of practice for that person.